my name is Roz. I'm one of the cancer nurses from the Irish Cancer Society, here to just give a little brief reminder to you all about the importance of self-breast awareness and how to do a self-breast exam. We first want to ask why do you want to do this exam, and what's the importance of it? And we recommend that you're doing this from the age of 18 on, or that sort of early ages, so that you become familiar with the idea that the breast is, this self-breast exam is an awareness of what's normal and natural in your breast, and how you're familiar with your body and how it is. Then you're looking to see, well, is there any changes? Because changes are not always equal to cancer. Changes could be any other condition. It can be, cysts, lipomas, they're benign conditions, and they're not uncommon in young women. So knowing them, being able to say there is something there, and not necessarily jumping straight into a cancer diagnosis for yourself. That would be more the third and the less frequent occurring one, which would be that you're looking for to see if there's a cancer developed that's at a very, very early stage, which, as we know now, that can be very, very accurately treated and has and curative. So that's the stage you want to find any cancers developing. So to look then at the best tool that you have in taking care of your breasts and your body is your fingers. These fingers here, the pads of your fingers, and that's what you're going to use for your breast exam. So if you're looking at the types of breast exam, keep in mind that you're doing your breast exam, self-breast exam. The clinical exam is what the doctor does. So that's where they're looking specifically, and their technique that they're using. So yours is your tops of your fingers, the pads of your fingers here, and gentle movements. The timing of it, try and pick a regular time in each month for yourself. And that would be a time when there is no, when it's after your period, when the breast is less sensitive. And just that you sort of set that sort of on the calendar nearly, that this is the time of the month that I actually do this. On a Sunday morning, it takes a few minutes, you're putting on the moisturizer, and you kind of include it into your routine. Okay, so the steps that we kind of use to sort of help you do the exam thoroughly and mindfully and confidently will be: 1, the standing position, the leaning forward position, and the lying down position. And those positions will help you get different access to different parts of the breast to make a thorough exam, okay? So that for yourself, that you kind of like, yeah, that's all feels good to me, okay? So the first one will be standing after your shower, standing in front of the mirror with your hands on your hips, and you're looking at the mirror. You can see you're looking again at normal shape, normal form, that the skin surface is even. So you're looking for what's normal. And when you're familiar with what's normal, then the abnormal will show up. Okay, so the abnormal you're looking for are the lumps, the bumps, the kind of change in that kind of orange peel skin, redness, tenderness in one particular area, scaling, those kind of changes. Now, if there's a change, we're not diagnosing a change, you're just being able to report that there's a change for you in that area. The same observations you're going to use for your next step, which is going to lean forward from the hips, let the breasts, relax forward. Again, you get a different vision of the breast as far as the shape and the size and the continuity of it. And then any abnormalities again will show up, and you're checking again underneath the breast if there's a larger breast. And while standing, or when you're lying down, I would sort of say, get used to just doing these 3 positions, like standing, then leaning forward, and lying down on the bed, so that you get kind of comfortable with it. For some women, they might turn around and choose to say, okay, I'll just be able to do this in the shower because their own familiarity with it, and also maybe their breasts, if they're younger and smaller, they tend to be able to manage that in the shower. But when lying down, we want to just extend the arm over the head, lie down, sometimes people put a towel under their shoulders and that, but you're really just trying to extend out the chest wall to be able to access all of the breast. You're using first the tops of the fingers here, and you're going to visualize the breast in quadrants. That, I think, is the easiest way to sort of say, yes, I've checked every area. Now, if you look at other YouTube videos, there's different techniques. Some do circular, some do up and down. But I personally say, just go through the segments yourself. Just doing the wave like that, nice and gently through each quadrant of the breast. Taking your time, no, not rushing, okay? But you're going right in, okay, to the chest wall here as well and around. So in doing that, the pads of the finger pick it up. We're not digging in, we're not hurting the tissue or anything like that. We're just doing a nice sleeve press all around the different quadrants, and you're happy with that. The same on the other side, all right? Finally, you're going to check the nipple. Here, sorry, two findings. There's nipple, all right, and there's nodes. They're the two end parts here. The end is you're looking to see that the skin is intact. It's nice, pink colour, no changes, no eczema, nothing, no itchy or anything like that there. You're also checking gentle squeeze if there's any exudate, if there's any sort of blood or clear fluid or anything coming from the breast. That's a change for you. You're also checking to make sure the nipples are just staying out, or if yours are inverted, whatever it is, what's normal for you. But if you're saying there's a nipple inverted and it's not normal, then you need to change to have that checked also. So you're back up to the nodes here. We're going to check around the clavicle here, this part, this here, and make sure there's nothing here, and then finally under the arm, okay? And you're just, if you can relax the arm onto something as well, or if you're lying down, you're just checking up under the armpit here to make sure that it's nice and soft and nothing, no nodes noticed, lumpy nodes noticed there. So you've done the breast exam, you're happy that there's nothing that you can feel that sort of feels different for you. That's 1 month put away. If it's a change, if you're concerned, you're looking at, in terms of what we've mentioned, the lumps, changes in skin, any discharge, if there's any pain or discomfort there, that make an appointment to see the doctor in 2 weeks, and if it still remains in the 2 weeks, the doctor will examine you and may send you for a mammogram. But the main thing we're focusing on is that you continually do this yourself. If there's lumps found, 90% of the lumps are found by women themselves, and there's only 1 out of 10 of those lumps that are actually cancerous. So, please do get into the routine of taking care of yourself, take care of your breasts, and if you're concerned, don't hesitate to call us on the Cancer Support Line on 1-800-200-700.